A vaccine advisory panel at the Centers for Disease Control and Prevention says the first doses of the coronavirus vaccine should go to healthcare workers and residents and staff at long-term care facilities. That's about 24 million people altogether. According to the advisory group, they represent the most at risk to infection and the highest percentage of deaths. For more on this, I want to bring in Kathleen Sebelius. She served as Secretary of Health and Human Services in the Obama administration from 2009 to 2014. She was also the governor of Kansas from 2003 to 2009. Secretary Sebelius, welcome. Thanks very much for joining us. You were in office during the H1N1 pandemic, and during that time, the CDC also provided a vaccine priority list. Given your experience, can you just give us a sense of how health officials today came up with their COVID-19 vaccine recommendations?
Well, they have watched this virus in the United States for now some 8 months, and we have a lot of data that they are using to figure out who in the states got the sickest, and of those very sick patients, who was most likely to die. And unfortunately, we know way too much about that, given the number of deaths that we've had. We were, in fact, dealing with a whole lot less evidence in 2009 when we had the vaccine ready to go, because we had some deaths, and the thing that was frightening at that point was some children had died, some young teachers had died with no underlying health conditions. So it appeared for a period of time that this could be very different from the typical flu. H1N1 was a strain of the flu, but those dying were different. But all in all, between 2009 and 2010, there were only about 13,000 total deaths from that episode. And so now, unfortunately, we're looking at over 265,000 Americans who have died. So looking at that population, the CDC very carefully said, here are the people most at risk: very frail, elderly in nursing homes, and the staff people, because they can give it to one another quickly, and most of them, if not all of them, have underlying health conditions, and certainly frontline healthcare workers who are on the front end of receiving patients every day who come into the hospital. We are breaking all hospital records. I think today we have 100,000 people in hospitals. So virtually every hospital in America has healthcare workers who are dealing with COVID patients every day.
Well, given how dire the situation is right now, which groups do you believe will be next in line for the coronavirus vaccine?
Well, Elaine, I think the CDC has talked about the fact that it's probably going to be the so-called essential workers, people who are not able to stay out of a workplace, restrict a job opportunity, may work very closely side by side, everything from prison guards to people in meatpacking plants, but also people who keep the services going, folks who are picking up the trash in cities throughout this country, grocery workers, others, to make sure that the rest of us are safe and secure. So some of people have the luxury of being able to work out of their home spaces, have the opportunity to keep themselves socially distanced. I think the next group is likely to be folks who really don't have that opportunity. And certainly in that group, anyone with an underlying health condition. But the vaccine will come relatively slowly at first. Hopefully the FDA will be convinced by the data that they're going to take a look at on December 7th that this is safe and effective. The Pfizer vaccine is up first. A week later, they will take a look at that same evidence from the clinical trials about the Moderna vaccine. And ideally, if the experts are satisfied, both that it's safe and that it's effective, then we will begin to see people be able to be vaccinated pretty quickly.
And to follow up, both Pfizer and Moderna created their vaccines in record time. Something that normally takes years happened in a matter of months. Do you have any concerns about the pace of this rollout?
Well, I think that the companies have been pretty open and transparent about what they are doing, who's included in the trials. The FDA has been very careful to make sure that there were enough minority participants, that there were enough older participants. I mean, the worst of all worlds is to somehow cook up a clinical trial where it's just young and healthy people and miraculously everybody is fine. That is not what these trials were like. They were able to gather very quickly enough people to participate. Unfortunately, again, because the United States has seen more disease than almost any other country in the world, and the trials were able to be conducted quickly because there's a lot of community spread. I think that the FDA can add additional confidence, making their deliberations very transparent, what they're finding, who is most likely to be affected. I think the fact that it's a two-shot regimen makes this even more complicated. What we don't know is how immune might you be after one shot? What if people forget the second shot? What if they don't go back? Those kinds of questions I think the FDA will be dealing with. But given the number of deaths that we've had, given how serious this virus is, I think there is some urgency to get what appear to be two very safe vaccines into people's arms as quickly as possible and save lives.
And on the Pfizer vaccine, what do you make of the fact that the UK was able to authorize that vaccine made by an American company, Pfizer, and a German company, BioNTech, ahead of the US?
Well, I think the FDA, again, is regarded as the gold standard around the world. And there are steps that are taken here in the States that, frankly, some people skip. I don't have a clear notion of how the UK leapt over some hurdles, but I'm very comfortable that the FDA is breaking all-time records. The fact that we may have a authorized vaccine, at least an emergency use authorization for a vaccine, in the same year that the novel virus was at first detected is remarkable. And it's really a tribute to this public-private partnership of, kind of warp speed and a lot of investment of government money and the scientists moving as fast as possible. We may be a week or so behind them, but I think that the steps taken in this country and the openness and transparency about those steps will give Americans confidence that this is not some political trick. This is not some, made up medication that will not be satisfactory, but they can be assured that it is safe, it is effective, and that it will bring this terrible virus to an end once we have enough doses to actually vaccinate all of America.
I just want to dig into that point a little deeper because, as you know, there have been some mixed messages at the federal level on the pandemic. Public health officials have consistently warned of the dangers while the president has often downplayed them. What do you think the public needs to hear right now about the pandemic and specifically the vaccine?
Well, I think the messaging is becoming much clearer. So you have the incoming president of the United States making it very clear he believes in science and he will defer to the scientists and he will listen to the scientists, and reminding people that even though there is promising news on the vaccine, it isn't here yet. And we have some very difficult and potentially terrible months ahead as people kind of let down their guard and say it's over, that we need to wear masks and socially distance and keep all the protocols in place. And we may need to actually restrict some gatherings and restrict some openings. You're hearing that on a regular basis from the scientists and from the politicians. The governors are beginning to sound one voice about the importance of wearing masks and social distancing. Initially, it was Republican governors felt reluctant to cross the President Trump, and it became kind of a badge of honor not to wear a mask. And governor after governor after governor, as disease has ravaged their state, say, we beg you, wear a mask, pay attention to the rules. So the one message, I think, is very effective. And scientists are very clear about what the standards are that the FDA will look at, what the tests are about. And I think President-elect Biden will defer to them, let them do the talking, as you just saw with the CDC, that meeting, you could live stream it from your living room anywhere in America. You could listen in on how the CDC arrived at these priority populations. I think we'll have a lot of the same transparency around the FDA meetings, and that should give Americans a lot of confidence that nobody is kind of cooking the books, that nobody's spinning, that they don't know what the science really says, and this is some politician's view of what's going on. They'll be able to watch this process as each step along the way, and hopefully that will give them great confidence that they should line up when available, when it's kind of their turn, get ready, and hopefully that this is a key to rebuilding life as we knew it.
And I take it you will be vaccinated once it's widely available?
Absolutely. When it comes my turn, I am happy to get in line, assuming the FDA moves forward. I'm not trying to leap over that very important step. They will look at all the data. They have, the 30,000 person clinical trial, first for Pfizer and then for Moderna. They will look at all the underlying information in that trial and what were the adverse effects, who was affected, how badly. They'll make that all very clear, and they'll put it out for the public. But a vaccine that's 95% effective is one of the most effective vaccines that we'll have seen in a very, very long time, far more effective than the seasonal flu vaccine, which scientists have to kind of guess about what's coming and then try to design something in anticipation. This could be a real home run in that it hits exactly the target that they're looking for.
In the meantime, patience and continue with those mitigation protocols. All right, former HHS Secretary Kathleen Sebelius. Secretary Sebelius, thanks very much for taking the time to talk to us. Really appreciate it.
Good to talk to you, Elaine. Thanks.